So, Otang, I think we can start now. I think people will still come in, but that's fine.
Okay, thank you, Lisa. So, welcome and good morning, everyone. So, thank you for your time and your interest. For attending the side event of the OECD Forums on Due Diligence in the Garment and Footwear sector. So I would like to introduce myself. My name is Otang, as Executive Director of Trade Union Rights Center, Indonesia. I will act as a moderator in the sessions. So it is an honor for us to organize the sessions, which conducted by 4 civil society organizations, consists of Trade Union Rights Center Indonesia, CVDEP India, Femnet, and Sutwin from Germany. So this session will address the topic on a gender-sensitive lens on occupational safety and health. Why is it needed in the garment and footwear industry? So the panel will present the latest key findings of their research on gender-sensitive OSH concerns conducted in the 2 production regions, first at Bangalore, India, and second at Banten Province, Indonesia. So the research put the spotlights on risks that are overlooked by a gender-blind eye in the value chain of garment and footwear, not only in general, but also in both regions. In the research, trade unionists also shares their first-hand experience with respect to the intersections of gender and occupational health. The research also involved conversations with relevant stakeholders groups, including health experts, brands, as well as industry associations, MSI, civil society, and government agencies between the spring and winter 2022. So for all the participants of these sessions, definitely we will provide an opportunity for all of you to ask questions or comments. So you can write your questions or comment in the Q&A box during the presentations. So after all the presentations, I will read your questions to the panelists so that the panelists can answer it. Hopefully, from these sessions, we can learn about the project context and the latest discussions on gender-sensitive OSH, both in sourcing companies as well as in the supply chain in garment and footwear, CMT factories, and footwear CMT home workers settings. Okay, so then I will introduce our 4 panelists in the sessions. We have first speakers, Lisa from Femnet. Lisa will explain about the project context. And the second speaker, we have Jiska Gochechwik from Sutwin. She will present on OSH perspective from the brands and retailers. And the third speakers, we have Rizky Amalia Kiki from TURC Indonesia. She will present the key findings of the research related to the situations of women workers OSH under the pressures of production target and the social reproduction spheres. And the 4th speakers, we have Kaveri from CVDEP India. She will present on health vulnerabilities and access to healthcare among the garment workers in India. So I would probably give a very short information to you that we are happy to also welcome a trade unionist from Indonesia who will share her experience from the field later. So without any further ado, I'm going to give the floor to Lisa, who's going to brief us on the context of this project initiative. Lisa, please, the floor is yours.
Hello, everyone, and thank you, Otang. So, as Otang already said, we are here today to learn about the research findings related to the gender-specific health risks in the garment and footwear industry. And these studies were carried out within the framework of a multi-actors partnership that I will introduce to you now. It will only be a very short overview since the focus today lays on the research findings. And if you have any other questions on the project itself or on how to participate in it, we are very happy to get in touch with you later. So first of all, the multi-actors partnership is being implemented by the 4 organizations that Otang already introduced before: the Trade Union Rights Center from Indonesia, CVDEP from India, the Sutwin Institute, and Femnet from Germany. It was started about 1 year ago, and the first phase is planned until November 2024. Our goal is to improve the health situation of women workers in the garment and footwear industry in India and Indonesia. We have several strategies to reach that goal. The first one is to create knowledge on gender-specific health risks in the industry, as a lot is still unknown. We are also looking at the needs of relevant stakeholders. And apart from the women workers themselves, the relevant stakeholders in this case are trade unions, factory management, and companies. In order to create regional specific knowledge, TURC and CVDEP have been conducting the research in their project areas Bangalore, India, and Banten and West Java in Indonesia. They focus on the protagonists of the story, women workers and trade union representatives, but also on the perspective of factory management experts from the medical field and others. In the meantime, the German partners Südwind and us from Femnet had conversations with representatives from brands, standard setters, MSIs, academics, and other experts to include their perspective. And as some of all of these people are also here today, I would like to use this opportunity to thank everyone that has been involved so far for their cooperation. As this is a multi-actors partnership, the mutual cooperation is essential to reach our very important goal. All of this leads us to our second strategy, the establishment of sustainable dialogue structures. CVDEP and TURC are right now setting up core groups in India and Indonesia that involve, for example, trade unions, factory management, and local NGOs. On the international level, we are planning a dialogue forum that will involve the regional groups, the regional core groups, and also brands, MSIs, and other international experts. Following this, and based on the research findings that you will hear today, we will develop concrete and practical guidelines which will subsequently be implemented in pilot factories. So we are looking to really develop guidelines that won't be paper tigers. In order for you to get a better picture of our multi-actors partnership of the structure, I wanted to show you this slide very quickly. As you can see in the blue bubble, we have the project team consisting of the 4 NGOs, CVDEP, TURC, Südwind, and Femnet. And in the greenish bubbles, you can see the regional core groups, which consist of the local NGOs, trade unions and factory management and MSI representatives. And surrounding all this, we have the dialogue forum, which brings together the regional groups with international brands, MSI, standard setters, and other international experts. So we can already announce a save the date for our first dialogue forum, which will take place on May 16. And with this, I would like to pass the word to my colleague Jiska Gjovcik. She's a researcher and project coordinator from the Südwind Institute, and she will give you a very quick insight on what we did in Germany to shed a light on the topic of gender-sensitive OSH before we move on to the regional studies in India and Indonesia. Thank you very much.
Thank you, Lisa. As Lisa mentioned before, we started in spring 2022, Femnet and Südwind, to talk to about 20 companies from the sector, further standard setters, union representatives, and experts. And we asked about gender as part of corporate social responsibility efforts and about current dynamics in occupational safety and health. And the word cloud that you can see here summarizes what brands representatives spoke about when we asked about health in the supply chain as part of their work. And analyzing the conversations, what you can also see visually here in the cloud is that when we talked about OSH systems, the CSR representatives mostly focused on safety, such as fire safety and machine maintenance, but hardly inquired into health of workers, including especially mental and reproductive health. Many interview partners identified the need for a gender lens in OSH in the conversations, responding to their perceived need in the production units, as well as to the increasing awareness of consumers with respect to gender equality. But there was great uncertainty what a gender lens in OSH actually means. Together with the stakeholders, we identified at least 3 needs for better OSH systems that imply a gender lens. First of all, more accessible and usable gender data is necessary. Secondly, options to detect gender discrimination in the value chains need to be improved, as the current ones are experienced to be insufficient. And finally, and that's the basis of what we're talking about today, our systems need to respond to local gender norms and the prevailing problems of each production region. We need to see and to understand which aspects of discrimination are caused by the structures of the garment and footwear sector, or patriarchy as a global phenomenon at the one hand, but on the other hand, which aspects are rooted in the specific versions of the patriarchal structures of a particular region of production. And that is why we see the studies which we will now be presented as so crucial to improve our systems in the sector in the future. The next speaker is Kiki Amalia Fatiha, social scientist and labor rights expert, whom conducted part of the field research for TURC in Indonesia in the project that we just described.
Thank you, Jiska. Good morning, good afternoon, everyone. I am Rizky Amalia Fatiha, representing the Trade Union Rights Center or TURC, a labor research and advocacy institution based in Jakarta, Indonesia. We would like to present our findings on women workers under the pressure of production target and the social reproduction sphere, case studies on the formal and informal sectors of shoes and footwear industry in Indonesia. Next slide. Firstly, I would like to explain about the methodology, region, and informant that used in this research. This research used feminist methodology because studies want to capture women's experience and tend to be sensitive to reveal women's experience. The data compiled with conduct FGD with women workers and women union representatives, interviews with women workers and local stakeholders, and observations at shoes factories and home-based workers' house. This research conduct on formal women workers in Serang District and Tangerang City, Banten Province, with tier 1 suppliers producing for international brands and have 7,000 until 54,000 workers. And for informal workers, we conduct this research in North Jakarta, Jakarta Province, Indonesia. Next slide. This slide would like to explain research framework that used in this research. This research develops a framework of production sphere and social reproduction sphere, where these two spaces influence each other, as shown in the illustration. This framework is developed and used because women workers, apart from being the subject of workers in the production sphere, are also subjects in the social reproduction sphere, in this case as a wife, mother, and child, which make these two spaces correlate with each other. The broken line shows lockdown and COVID-19 situation, where in this situation, women workers face at least two things, namely the risk of transmission of the COVID-19 virus when working, while women workers still have to work to meet production targets, face pressure at work both by fellow workers and by supervisors and the work system that is implemented, especially the line-based work system, which is indicated by the unbroken line. And there is a change in the children's learning system to learning from home, which poses a challenge for women workers when they are at home. And women workers also face with housework, supporting family financially and non-financially, and caring for children and or parents that they face on social reproduction sphere. Women workers on social reproduction sphere also face other risks such as domestic violence and stress, affect concentration at work, and potential for work accident on production sphere, or what we better understand as a factory. Next slide. This slide will explain about shoes production operate at the factory level. This illustration is prototype based on our findings in 3 factories in Banten Province. On the left illustrations show how work inside a shoes production building department, namely CSA buildings such as warehouse, cutting, preparation, sewing, assembling, quality control, finished good, and packing. The illustration on the right shows each section. For example, is cutting department using the line system that give workers pressure vertically and horizontal. In each line system, there are approximately 40 workers. This number may vary by department, supervised by one supervisor. Supervisors in one department are headed by one department head, and this illustration wants to show that workers are at the bottom of the line system in the shoes production chain, potential to be pressured by various factors such as high production targets. Horizontally, workers are stressed because each part depends on the other or for smooth production, and vertically, workers pressured by supervisors are department head, systemically and structured. For example, supervisors using harsh words that lead to verbal violence conveyed by supervisors to workers who are on the bottom line. Next slide. This slide will explain about production and social reproduction sphere. Production sphere explain our findings to women workers in the 3 factors studied in this research. There are 2 aspects in production sphere like high target and mini-cell system and low income. In high target and mini-cell system, there are various impacts faced by women workers such as verbal violence caused by supervisors shouting at them as operator workers, stress and accidents that, for example, needle prick and unhealthy allergies, lack of access to water and toilet that cause dehydration because workers drink lead, kidney stones, and severe urinary tract infection. That impact from high target and mini-cell system is repetitive motions that cause muscle strains and back injuries. A less impact because high target and mini-cell system is no menstrual leave, which is Indonesia government law only regulates menstrual rate. So the consequences, if the women workers don't feel menstrual pain, they have to continue working. Second aspect is low income. That cause women workers unfilled needs like sanitary pads, a supplier or management not provide sanitary pads for women workers in factory. That potentially from economic side cause increasing personal expenses, and from health side women workers have poor menstrual hygiene, and because women workers can replace sanitary pads as need recommended. Last aspect on low income that cause them large amount of debt and working overtime to get overtime pay. In social reproduction sphere, women workers being the breadwinner make them to support financially their dependents like husband, children, parents, and others family members. Support financially their dependents potentially cause women workers have stress or financial burden, and women workers in formal sector also have other problem is unemployed partner. Unemployed partner doesn't always get their partner to take on the role in household chores, so cause unequal division of household chores. This problem cause marital problems, and same with stress of financial burden. Marital problems also potentially women workers have mental issues. As I have explained on framework analysis, potentially cause in production sphere like women workers get work accident, like for example have needle prick. Mental health issues, apart from being triggered by stress originating from the social reproduction sphere, are also potentially triggered by stress and pressure in the production sphere. And next slide, I will explain about home-based workers. Home-based workers, due to lack of government recognition, the rights of based women workers are unregulated, like very low wages, poor working conditions, no facilities which lead to work accidents and occupational disease. No boundaries between the workplace and the household costs. Their children also suffering from disease, and a lack of access to health service lead to untreated chronic disease. Before I explain about the conclusion for this research, the findings in the field shows that there are several aspects of OSH that should be the responsibility of the company. In fact, is still a personal expense for workers themselves, such as sanitary pads that are not provided. While companies calculate workers' wages based on the minimum wage, the fact is that they are the backbone of the family and must find additional money to meet their family needs. And so we have some conclusion based on our research. First, the health and safety of factory women workers is under pressure from high production targets and domestic burdens. The double pressure affect in their health, and current OSH system do not account for that. with fast work cycles and high production target, workers at the lowest level, such as operators, often feel the most verbal abuse from their supervisors or management, which formulations that are calculated based on minimum wage, not living wage, force women workers to find additional money to meet their family needs. The debate on the term of menstruation break and leave is political language created by policymakers that unions paradigm place menstruation issue as a human right. On the contrary, the government puts it by legalistic approach, and thus the absence of the state recognition on the home-based workers is the fundamental problem causing them to experience multiple layers of vulnerability. Thank you. Next presentation will explaining by Kaveri from GPDEP India about occupational health and well-being of the family workers in the garment sector in Bengaluru, India. Please, Kaveri. Thank you.
Thank you, Kiki. Good morning and good afternoon, everyone. I'm Kaveri from CIVIDEP India. CIVIDEP India is a civil society organization based in Bangalore and with field offices in other locations in South India. Our work aims to safeguard the rights of marginalized communities, especially workers employed in global supply chains like the garment, leather, electronics industries, and coffee and tea plantation sectors. We do this by critically analyzing business and human rights due diligence by global corporations in their India supply chains. It is this focus on business and human rights that made us study gender and health in the garment industry in Bangalore, which primarily caters to global corporations. In India, the garment and textile supply chain is the second largest employer, employing over 45 million people. In this vast industry, our focus is to understand the health of factory-based workers in Bangalore's garment factories. Health is a crucial determinant of a person's holistic development. This study was conducted to understand the health vulnerabilities of women garment workers in Bangalore and their access to healthcare facilities. The primary data for the research was collected through focus group discussions with about 90 women workers and semi-structured interviews with key informants. The results of the focus group discussions made it evident that workers face several health issues like musculoskeletal, malnutrition, sexual and reproductive issues, mental health issues, respiratory issues, pulmonary issues, and allergies. Majority of the workforce is aged between 80 to 40 years and are first-generation workers who have migrated from rural areas. Prior to joining the workforce, they had financial constraints which forced them to drop out of school and perform unpaid care work. These workers are usually the sole earner or the main earners of their families. In most households, though the husband works, the contribution is either little or nothing to the household expenditure. And hence, the burden falls on these women workers. These women workers are responsible to take care of their children, elderly, and household chores without any additional support. These women work 8 hours a day for 6 days a week, and at times, due to the sheer need to earn extra money, they work overtime as well. Some of them also take additional jobs like domestic service, piece rate work, and selling flowers. They earn less than $114 a month and face wage discrimination. Workers lack recreational time or leisure time as they have the burden of unpaid care work. This industry employs majority women as they are considered easy to handle. Shop floor abuse is by now a widely known feature of the garments industry. Women working on the shop floor face severe verbal, physical, mental, and at times sexual harassment. Despite being sole earners, they face domestic violence as well. Such is the lifestyle of the workers who produce clothes for us. Due to such precarious working conditions and family environment, these women do not have the time for their personal healthcare needs. The root cause of occupational health issues among these workers is the ingrained production system within garment factories. In the assembly line production system, workers are placed in an uninterrupted and consecutive production line according to the process sequence requirement. For example, garment bundles are loaded at one end of the line and moved from one station to another, leading to a fully stitched garment at the end of the line. This system helps in increasing the performance of workers through limited operation and maintaining the consistency for the flow of garments. It creates a monotonous process for the workers, limiting the social interaction with one another. Due to high production targets, workers face various ergonomic issues. For example, as stated earlier, a garment bundle is loaded at one end of the line and moved from one station to another. Each worker stitches a particular part of the garment in the line. Let's say worker A would stitch the collar, worker B would stitch the right shoulder, and worker C would stitch the left shoulder, and so on. If worker C in the line takes a break, worker D would have to wait till the fabric from worker C arrives, and hence disrupts the entire line, leading to slowing down the production. This is a reason for line managers discouraging workers from taking breaks. It's interesting to know that they do not say this directly, but embarrass workers through verbal abuse. Hence, workers, out of guilt for disruption of the line, fear and embarrassment, do not take rest, drink water, or use a toilet. They even forego their lunch break so that they meet the production target. All these leading to various health issues. The resultant changes in lifestyle to meet the production demands has an adverse effect on the musculoskeletal, nutritional status, sexual and reproductive health, and mental health. Majority of the women workers are malnourished and anemic. Thus, often face severe bleeding, extreme pain, and discomfort during their menstrual cycle. The findings of the study show that musculoskeletal issues were the most common occupational health issues. Around 67% of the skilled workers experienced neck pain due to the posture they have to maintain while working. 53% of the workers were anemic due to lack of access to nutritious food and lunch breaks. 65% of the workers face menstrual issues due to poor nutritional status and strenuous working conditions. Around 87% of the workers complained of stress due to exceptionally high production targets set by the suppliers. Let's focus on the sexual and reproductive issues of the workers. The study reveals that workers complain of menstrual irregularities, excessive white discharge, urinary tract infections, miscarriage, abortion, and hysterectomy. Menstrual irregularities are quite common among workers. Since workers are unable to drink water and take sufficient breaks, they face frequent urinary tract infections. While women are menstruating, low wages do not allow them to buy sanitary napkins. Instead, they use rags, leading to fungal infections and other reproductive issues. Pregnant workers are expected to meet the same target as regular workers and do not have sufficient breaks. Hence, the industry sees quite a few abortions and miscarriages as a fallout of work. Young women workers from the age of 30 years prefer hysterectomy, which is otherwise also known as removal of the uterus, over menstruation with heavy bleeding that leads them to miss work days and wages. Access to healthcare is a basic right of a human being. However, access itself is relative to socioeconomic status. The study discussed the role of various healthcare facilities available for workers. It further aimed at understanding workers' perspectives on the healthcare provided and their willingness to avail of it. Though there is a state insurance for healthcare and public health facilities, a large majority of workers prefer private healthcare facilities over state health insurance. This is due to the time inefficiency of public health institutions that take a long time to provide care and don't operate during workers' off-duty hours. Workers believe that accessing state insurance is a tiresome process and often end up spending more than a day for a simple treatment. State insurance is often seen as a leave-providing mechanism and are approached only during major health issues. Workers would approach the on-site healthcare facility for immediate or basic healthcare support. It was shocking that workers spend an average of 25 to 30% of their salaries in a month on healthcare. These workers earn a minimum wage, and the additional burden of health leads them to borrow money from non-institutionalized financial systems and end up paying a higher rate of interest. The inability of clearing the loans timely leads them into a debt trap, pushing the family further into gruesome poverty. In conclusion, the nexus of gender and exploitative labor has a significant impact on the women workers' health and well-being. Lack of awareness on their health and hygiene has a significant impact on the health of these workers. Low wages affect their inability to buy essential commodities, which leads to unhealthy practices. Unionization and collective bargaining is discouraged, and hence worker representatives have very little or no role in addressing worker demands on healthcare benefits. A gender lens needs to be applied to occupational safety and health in this industry, as the workforce is dominated by women workers. A holistic approach becomes essential to ensure the well-being of a worker, which means, along with occupational safety, the focus should be on occupational health as well. Thank you. Would like to hand it over to Atang.
Okay, thank you, Kaveri. And I think what the previous speakers have presented would be more complete if we could listen directly to the experience of a trade union activist from the field who is currently still working in the factories about the health and safety conditions of women workers in the shoe industries. So already with us, a trade unionist from Indonesia. I'm happy to introduce Ms. Intan from SPN labor unions, who are currently serve as a chairman of the SPN at Banten province. She will present on the women workers OSH at the shoes factories in Banten province, Indonesia. So without any further ado, Ms. Intan, the floor is yours.
Yeah, thank you, Brother Otang. Good afternoon, brother and sister. Hello, my name is Intan Indria Dewi. I'm a chairperson of the National Trades Union Federation in the province of Banten. Aside from being active as a labor activist, I have been working on one of the largest manufacturing companies in Banten province, Indonesia, since 2007. The company where I work has 58,000 employees, and the majority of them are women workers. I have been involved in the trade union movement for 14 years. So I can say that working in the factory is not only physically and mentally draining, but we have to face various risks such as a health risk, work accident, violence, harassment, and also even being ostracized society outside of the work as well. And I want to talk about on this equation. I would like to share with all of you about the occupational health and safety issue faced by women workers at the shoe factory in Banten province, Indonesia. First of all, the issue is of occupational disease. The shoe company used a continuous and uninterrupted work system called the mini cell system. As a Sister Kiki mentioned it before, the mini cell system results in each part of the production area being linked to each other, meaning a worker cannot leave their work easily, and it's even difficult for them to just take a drink or go to the bathroom. As a result, workers often hold urination and become dehydrated. In addition, the working environment is also poor, as almost the entire production area has a high level of noise above 85 decibel, and it's vulnerable to radiation and exposure to harmful chemical and dust. Working conditions like this certainly affect the health of women workers, characterized by the appearance of some symptoms of illness such as dehydration, back pain, urinary tract infection, neck pain, trembling and numb hands, and hearing and vision loss, itching and rashes on the skin, shortness of breath, and others. The symptoms slowly accumulate and cause occupational disease. Even if they realize even if they realize it's a very the illness they suffer from is an occupational disease. Even if they realize it's very difficult to prove that it's an occupational disease. For example, if a worker in the cementing area is the process of applying glue to the outsole of the shoes. So the workers in the cementing area develop skin cancer due to the continuous exposure to UV rays and chemicals. It's difficult to prove that it is an occupational disease because it's only detected a few years after working. Even in Indonesia legal regulation, many procedures must be fulfilled for an occupational disease claim. So in the end, the occupational disease is not well handled. The second issue is the verbal violence. One of the special conditions for a woman is having menstruation every month. Appropriately, company who employ woman worker, then the company understand that there is a right to take a menstrual leave every month. But in fact, when a woman worker takes a menstrual leave, she will receive like a ridicule or a bullying from her colleagues, from her friends, or be scolded and yelled by her supervisor. So women workers prefer to force themselves to work in a condition that hold a menstrual pain, discomfort, less focus, and concentration. This is what triggers the occurrence of the work accidents. The above condition can be prevented if the government, employers, and workers have a mindset and recognize that menstrual leave is a human right. Then the fulfillment of the menstrual leave right is absolute, not only black on the white listed in the labor laws. And the third issue is domestic violence. The patriarchy culture is still deep ingrained in Indonesia society. The implementation of the gender equality in household and society is an unfinished task. The assumption that domestic work is a woman's work also seems to be an unwritten rule that must be followed. Then, whether they have to work hard at the factory to achieve production target, women workers still have to do household chores. This makes women workers experience multi-burden, not only double burden. Women workers also experience domestic violence because the husband doesn't understand and lack of awareness of the gender equality. When women workers become a victim of the domestic violence, there's no mechanism to regulate the domestic violence leave. So women workers have to continue working in unstable mental condition, under the pressure of the production target, and physiological pressure, and the physical wounds, which are prone to work accidents. The fourth issue is financial pressure, but I still want to say it's economic violence. When we're talking about the gender-based violence, it's not only about the physical, verbal, physiological, and sexual violence, but also about economic violence. With determination in Indonesia is to use the concept of the minimum wage, not a living wage, which can meet the living needs of a worker. And if we analyze it more depth, there is an implicit difference in the wage received between men and women workers, because women workers have to pay higher tax than men workers. So the net income received is very low, while women workers are expected to be the main breadwinner for their family. Therefore, women workers often deliberately work overtime repeatedly to get a high wage and neglect their health. If economic problems become more pressing, they blindly start looking for an instant loan. And I have a heartbreaking case, and this case occurred in a company without the labor union or the trade union, but this case was handled by our organization, by the legal aid institution in SPN. That was a woman workers who borrow money from her co-worker. He is a mechanical supervisor. And when the woman worker cannot pay the loan, the mechanical supervisor asks the woman workers to pay by sex. And this tragedy occurred in the secluded and dark workplace toilets without adequate lighting, and placement of men and women toilet is still on the same path. So it can be concluded that occupational safety and health are also closely related to handling the gender-based violence. This is what makes the trade union and employers have to concern about both of them. And the various issue I have mentioned earlier also occur in India and other production countries. The issue can be minimized if there are a systematic policies and mechanism for handling the OSH and the GBV cases in the workplace. Hence, the Women Workers Protection House, or you know about the safe house, it's a same name, can be a solution. Unfortunately, there are only 5 units of safe house in Indonesia. Without safe house, complaints from women workers cannot be handled quickly and effectively. In addition, safe house must be equipped with the counselor who can help overcome to post the violence traumatic. And from my organization, I would to share about the effort from the SPN that already do to ensure the implementation of the occupational safety and health regulation and to end all form of the gender-based violence in the workplace. In 2020, we appointed 8 companies for occupational safety and health and anti-GBV pilot project. And in the 2021, we conducted questionnaire and analyzed survey results on the OSH and the GBV and negotiated with the management to agree on signing the MOU and creating a monitoring team regarding the occupational health and health and also the anti-gender-based violence. In 2022 until 2023, we are negotiated with management to include the woman occupational self and health and the maternity rights and anti-gender-based violence in the CBA. 4 of the 8 company or 4 of the 8 factory agree to accommodate anti-gender-based violence and all issues in their CBA document based on the SPN effort. SPN is the name of my organization. So there is from my spec and my opinion, my testimony about the women workers OSH in the shoe factory in the Banten province. Thank you. And I give back to Brother Otang.
Okay, thank you, Sister Intan, for your interesting presentations and sharing. So now it's time for us to enter the question and answer sessions. I know the time is very limited for us. So I will read some questions. We have quite many questions. So first, questions from Emma Falk. How do the panelists reflect on the kinds of women empowerment training programs offered to workers by some brands, which do not address any of the structures underlying the issues workers face, and instead focus on teaching the individual healthier behavior? So maybe one of the panelists want to answer these questions. Could be Jiska first, and then we can go to Kaveri.
Yes, thank you, Otang, and thank you for this very good question. I will answer on the general level now, and then maybe Kaveri can add. And I have 2 points to say about that. First of all, of course, it is important for the women workers to get the chance to understand, for example, their health concerns and what they can do about them, and to have career chances in companies, etc. So I do not want to limit that. But yes, I mean, what the studies show is that women cannot deal with all the concerns on their own, because many problems are severe issues that are rooted in the structures, I mean, as the question already implies. And then my second point is that focusing only on women, as many women empowerment programs do, also misses that men are also part of the picture that we see, and that we also need to work on the role of men, both on the production floor and also in the reproduction sphere, as TORC and CVDIP have also shown.
So Kaveri, you want to add?
Yeah, I completely agree with whatever Iska just mentioned. But along with that, one thing I would also like to share is that some of the factories here, even in Bangalore, also provide trainings for workers. But most of the time, these trainings these are not really related to the health awareness or the health related awareness that they have to be creating. It is mostly just for the sake of having a training for the workers, because it is being said or told by the brands. They just have some kind of a training, but they usually don't really focus on the health awareness bit. So yeah, so it's mostly about women empowerment, but health awareness, factories don't really have such kind of trainings for the workers.
Okay, thank you, Kaveri. Kiki, you want to add some more points?
Yeah. Maybe I want to answer the question from Emma. Of course, this is a very fundamental criticism of women's empowerment programs and question marks, because many issues of occupational health and safety for women workers are based on work system applied in this industry. For example, the MINISAL system that makes women workers have difficulty accessing basic rights such as menstruation leave, urination, and so on. So in my opinion, brands are not only obligated to teach how to live in healthy life, but also apply the basic rights that women workers should receive, and look again at the work system in this industry in a better way. Thank you.
Okay, thank you everyone for the answer. So I would move to the second questions from Christophe Margot. So yeah, thanks for the interesting presentations. Did you break down your data, maybe Indonesia and India, first to the factories producing for the national regional market, and the second factories producing for the international brands? We would expect due diligence to lead to better situations in factories producing for international brands. So did you break down the data for both of you, Indonesia and India?
Yeah, for the Indian study, we just looked at the export garment brands. We did not look at the domestic brands, but it was only the export garment factories.
Okay. So how about Indonesia? Yuski?
Yeah. For Indonesia, our informants are grouped into namely from formal women workers who work in factories that produce international brands located in province, and home workers who are domestically oriented footwear products. And for factories that produce international brands, we have a list of factory names, but for home-based workers, we do not have enough data on the names of the factories because it is difficult to access all the factories because home-based workers can get orders from several factories.
Okay, thank you. So it's interesting. So I think I can move to the next questions. So there are questions actually. Two questions are asking about the higher tax for women than men for Indonesia. So maybe there is someone can give a little bit explanations on that.
Yeah, I would like to answer the question. Why women have to pay the higher tax? Because the law or the legislation about the tax is regarding to the marriage law in Indonesia, which the state that men are the head of the household. Therefore, men have to take a responsible to the woman, to their wife. So the women have to pay more high tax than men workers because of that law. The tax law is regarding to the marriage law in Indonesia.
Okay, so it refer to the marriage law in Indonesia, yeah. So the burden would be more for women. Okay, thank you, Ms. Intan, for the explanations. So I think I would move to the next questions. It's quite interesting. That wait a minute. So there is a questions regarding to the recommendations. So does any recommendations that you provide for the brands actually, or any better practices that you have actually about the initiative?
Can I answer that question? Am I audible?
Yeah. Sorry. I'm still muted.
Okay. Yeah. So the way what brands could do exactly would be like Lisa actually mentioned right at the beginning of the presentation, that we would be having more of dialogue forums and forming of the core group and also implementing the guideline. Maybe brands can also be a part of these discussions. Along with that, what brands could also do is create awareness amongst workers, like have trainings on regular basis for the workers on health and well-being, and also building the capacity of the line managers on gender-based health needs and gender-based violence. So that could be one way of what brands could do. And the other, the other ways of how brands can be more involved is by also providing sanitary napkins to the workers, and also nutritious meal for the workers in the canteen, because most of the time workers do not have the time to have lunch. So if suppliers can provide nutritious food for the workers, it would definitely help them in the long run.
Okay, thank you. So, or Kiki, you want to add some recommendations maybe for brands and suppliers?
Yeah, similar with Kaveri, I think brands or suppliers can provide fundamental rights for women workers like sanitary napkins, and can access to toilet, to urinary, and can access menstrual leave, I think. Thank you.
Okay, so I would give to an opportunity to Lisa. Lisa, you want to answer these questions?
Yes, of course. Thank you, Otang. I think my colleagues have already mentioned very important facts, and I think it is important to know that we will be sharing our recommendations, but part of the project is that we will be working together with different stakeholders to see how we can actually improve the situation. And this will be part of the process of how we actually establish the guidelines. Will be a cooperation. We will look at the studies, of course, and the findings, and then look at our recommendations, but also involve other perspectives to see how these can actually, and in a very practical way, be implemented in a factory. Because like I said before, we don't want another paper tiger. And if that's also maybe interesting, if you would like to be informed more on these issues, you can sign up for our newsletter. You can be part of our dialogue forum. You can get involved with us. With our contact information is shown right here. So you can also please, if you are interested, you can type in your email address in the Q&A, and then we will send you some more information. We will share the presentation with all of you. But if you would like to get some more information, please share your email address. And also to those whose questions we couldn't answer now, we would very much like to get in contact with you via email. So if you would like that, then please share your email address in the Q&A section.
Okay, thank you, Lisa. Thank you for the information. So for those anyone who are still interested to get more about the project, please contact the project team that has been shared. And also the material, the presentations will be shared to you as well via email. So as a farewell message, because the time is very limited, we are going to end the sessions today. So please do not forget about the H in OSH, occupational safety and health. So health means the mental and the reproductive health. Good OSH systems are related to the organizations of works and management schemes. So I would like to end of the sessions. Thank you very much for your presence today in this OECD site sessions. I hope we can meet again later. So see you and goodbye. Bye-bye.
I'm leaving the webinar open for one moment in case people still would like to type in their email address.